Thanks everybody for joining us. I'm Sonia Berryman, Senior Manager of Primary Healthcare and Integration for the Primary Health Network. I'd like to acknowledge that we work on traditional lands of many Aboriginal clans, tribes and nations. I'd like to pay respect to elders past, present and emerging, and acknowledge the traditional custodians who care for this land on which we work and live. I acknowledge and respect their continuing culture and the contribution they make to the life of the communities in our region. Thank you to Centium for arranging the excellent presentations from David Parsons and John Williams this evening. We will now pass over to Daphne and Penny, who will be facilitating the webinar. Thank you.
Thank you for opening the webinar, Katie. Hello everyone, it's my pleasure to welcome you to today's webinar. I'm Daphne Brown, Manager Governance at Centium. I'd also like to introduce Penny Corkill, who is one of Centium's directors and who is assisting with the facilitation of this webinar. It's great to have you joining us at this disaster preparedness webinar, where we'll be taking you through how to prepare for, respond to, and recover from the impacts of emergencies and pandemics. The objectives of this webinar are to provide you with information so that you will be able to recognise disaster risks in your area. You'll be able to understand what's required to plan, respond and recover from a critical incident or pandemic, and to make you aware of the tools and guidelines available to you to plan, respond and recover from a disaster. I'll now give you an overview of what we'll be covering in the webinar and introduce our presentations today. So just to kick things off, I'll provide you with a brief summary on the engagement of Centium and the work we have done to draft disaster plan and documentation for the PHN. We're delighted to have David Parsons joining us today. David will be giving the first presentation, which will take us through what disaster planning is and why invest in it. David will also take us through a couple of case studies as part of his presentation. We're also really pleased to have John Williams, Director at HealthPoint, also joining us today from New Zealand. John will be taking us through the emergency response planning too. After hearing from our presenters, we'll also take some questions. Now, we may not have time to answer all of your questions, but we will collate all questions submitted today, and responses to all questions will be shared with you via the PHN. So just before we hear from our fantastic presenters, I just wanted to give you some background on our engagement, Centium's engagement with the PHN and what we've done. So we were engaged basically to develop two really important documents. The first document to be created was a disaster management plan for the PHN on how it functions prior to, during and after a disaster event. And the second document to be created was a high-level guideline document for primary healthcare service providers across the region on disaster preparedness measures. Now, before we put pen to paper to draft these documents, Centium consulted with a number of stakeholders within the PHN and the councils to obtain information on current disaster management processes, any pain points and any areas for improvement. We ran a workshop with Sonia Berryman and the team at the PHN, and we ran another workshop with council members. We also had one-to-one discussions with 6 council members who couldn't attend the focus group. We spoke to emergency and disaster experts within the region, which included the district disaster manager for the Far West Local Health District, and we also spoke to the emergency management officer for the Far West Emergency Management Region, both of which give us a wealth of information. Now, the discussions with these emergency experts also assisted in our research to establish the role of the PHN against the state disaster plan and also the New South Wales Health Disaster Plan. And finally, we also researched what disaster management planning had occurred in other regions and also learnings from other disaster and recovery efforts. So we basically reviewed and analysed all of that valuable information obtained during a consultation and research, and this enabled us to draft the Disaster Management Action Plan for the PHN and the Disaster Preparation Guidelines for the healthcare service providers. The 3 phases to becoming disaster ready are outlined in both documents. The Disaster Management Action Plan sets out the PHN's activities prior to, during and after a disaster. And the disaster preparation guidelines have been developed to assist healthcare service providers in really assessing the preparedness and readiness for a potential disaster. The guideline sets out information on how to plan and be prepared for a disaster, how to be ready to respond during a disaster, and how to recover after a disaster. The documents are currently out for consultation and will be finalised shortly. For further information on these documents, please contact Sonia Berryman at the PHN. Now, without further ado, I'd like to introduce David Parsons for the first presentation to give us a really good insight into what disaster planning is and why invest in it. David has an extensive career in the field of emergency management at local, state and national levels, as well as the corporate sector. David has completed a Master in Emergency Management, Leadership in Crisis Programme at Harvard University, Emergency Management Fellowship at Emergency Management Academy, New York, a Bachelor of Education, Lessons Learned Programme in North Atlantic Treaty Organisation, and is a Cert 4 in Training Assessment. That's pretty impressive, David. So I'd like to now hand over to David.
All right, Daphne, you can hear me okay?
Yes, we can. Right. Thanks.
Good, okay. Just before I start the slideshow, I just want to make a couple of comments. And just so people know, I spent the last 4 years working across Western New South Wales. So many of the areas where you work and where your places of work are. The first thing is to say that disaster planning's critical role is that when something goes wrong, you've actually got ideas and strategies to start taking action straight away. And we see many organisations wait too long, and then they've lost the game ball, because those who are organised get the resources first and have all the resources that they need, whereas those who sort of move later miss out. And I'll talk about that shortly. The other thing is that disaster planning is about the safety of our people, and about the actual continuity of our services to that critical community that we serve. Just a couple of quick lessons before I get underway. I've been in the game now for 42 years, and if you look at the current fires that are raging across New South Wales, there's common things come out all the time. No one understands how complex their local society is in terms of how it functions. Networks are critical. That's who you know that makes a difference. Those within the EM community, the people responding to disasters, unfortunately do take actions that will make your business harder to actually do, and that's only because they don't know that what they're doing interrupts your services. But they can be great help if you know them, and if you work with them, and if you inform them of your issues. And as we speak, the government is appointing recovery coordinators for all the areas affected by the bushfires. And those recovery coordinators, again, are critical to working with communities and working with you to get the best services for those local areas. So what I want to do is to run through an exercise with you and get you thinking. In the last 2 months, the New South Wales government has conducted 3 disaster risk reduction conferences, one at Coffs Harbour, Dubbo, and at Wagga Wagga. And one of the key thematics in that conference was to raise awareness of an emerging threat for New South Wales. Next slide, please, Daphne. Yeah, right. The current situation is that what we're seeing across the Western world is an increasing number of power grid failures. That's happened in London, that's happened in New York, it's happened in Germany. I'd rattle through more than 20 countries where in the last 5 years they've had power grid failures. This is because of the switch to the renewable energy market and the loss of baseload power. So our systems have a problem at the current time. We've had about 6 very close calls in New South Wales in the last 2 years, and the South Australian blackout was a great example. And for rural South Australia, some of those towns were without power for days. And that's because the system restart occurs in the cities first and slowly rolls out. The challenge is the longer you have a blackout, the longer that a power station isn't running, the longer it takes to restart. So power stations, you don't push a button and start them. They don't work that way. It's a long, drawn-out process. And the longer they've been running cold, or they haven't been running, the longer it takes to restart an actual coal-fired power station or a gas-fired station too. So the government is said at those conferences out loud, so there's nothing secret about it, that regional New South Wales could go without power for up to 5 days if we have a power grid failure. Now, the triggers for this can be varied. It can be major storm events, bushfires, or the fact that the system's trying to cope with renewable energy being produced in areas that the system was never made to handle. So, for example, across Western New South Wales, the solar farms are not running at full output because the system can't cope, and that would lead us to another black start risk. So we've got inbuilt instability while the system's rejigged over coming years to cope with the market towards a renewable energy market. Next slide, please, Daphne. So that's the current situation. So the risk is there. We all know about it. Everyone's talking about it, and you've now heard it too. So I want to paint for you an event that would cause this to happen. This almost happened last summer. We could have an event. We've got bushfires raging in the Georges River National Park, the south of Sydney. And the major transmission lines from the south into Sydney from the Snowy Mountains come up through this parkland. When you have a bushfire, it actually produces ionised and carbonised air, causes the big cables in the air to then arc out, and they shut down for safety reasons. We could have a second. Okay, it says there that we might be having difficulties connecting. Daphne, can you still hear me? Don't know why it's saying that.
Yes, we can still hear you, David.
Okay, I just got a warning signal came up. That's okay. And from the north, we have another major feeder comes into Sydney, and if we had fires up there as well, as we can see by that second narrative, with causing lightning strikes, causing a major fire, and again you'd have arcing under those transmission lines. That would cause the system to go to the next slide, which would then do, Daphne, good on you. What that would cause the system to go into panic. You can't have a power station running unless the power is going somewhere. It's just the mechanics of how they work. I won't go into that. So what would happen? The power stations would then go into shutdown mode, and they would spin down. That is, they'd be spinning and they would go towards an idle and then stop. Because the system would be not able to take the electricity. It would cause an imbalance and causes the system to actually do that. The problem is those turbines, if they stop, will take significant restart effort, and you've got to get. And it's challenging. You've got to get electricity to a power station to restart a power station. That might come from Queensland or from Victoria for another state, and it takes a bit of time. That would throw us into what we call a black start situation, and the state would have no power. We'd all be blacked out. Now, how long might that last? If everything went perfectly smoothly, we might find Sydney back on in 12 to 24 hours, and then have to roll that out across the state. So that would take a couple of days, like in the South Australian case study. If the restart for some reason couldn't go smoothly, and that restart extends to a day before they get it started, that means the power station's all been static. Yeah, we're in a world of pain, and that could take days, in which case they're saying 5 or 6 days maybe before rural and regional New South Wales gets their power back on. What we know from research is more than half of all backup generators don't work. Dubbo Hospital has seen this when storm a few years ago. Dubbo Hospital's both the generators failed to actually run. So because most people don't run their generators long enough to get them up to the operating temperature to know if they're going to work when it's a real event. And often the diesel becomes old and won't work. So again, good planning would actually mitigate that risk, but people don't actually do the good planning. Daphne, next one, please. So the first thing I'd like to think about, if in your planning process here, is to say, what are the current impacts of an electricity disruption on your business? Because I know in rural and regional New South Wales, you certainly experience regular blackouts for an hour or 2 hours. You probably consider that to be a fairly routine event, and you've built mechanisms around that. And that's the challenge: is we build mechanisms around the business as usual disruption. And I guess I'm probably not able to get people to throw in an answer there. Daphne, are we? So we just keep going and leave this as a thinking box. So that's the first thing I want you to think about is, what do you normally do? Well, here's the problem. What would you do though if that was for 5 days? You had no electricity, which means your mobile network's designed to run for 5 hours without electricity, 5 to 6 hours. So you'd have no mobile phones operating in that community. The telephone exchanges, depending where you are, may have a generator somewhere like Orange. The problem is though that with the NBN, if it hasn't got electricity at the user end, the system won't work anyway. management of your cold chain for your things that have to be kept cold. How can you survive 5 days without that? Don't forget, this is also affecting your home. It's affecting the school. It's affecting the hospital. It's affecting everyone in the town. So the whole town's got no power for 5 days. It means you can't, as they found in South Australia, you can't pump petrol. They had to go and get diesel off farmers' properties where they had it in tanks up in the air to be able to run emergency services vehicles because they couldn't get it out of the ground. And who would you be talking to once you realise this actual disruption is longer than usual? So when you get alarmed, at what point do you go, that's a blackout that lasts an hour versus, this is now 4 hours, or like on my farm, 8 hours, where you go, yeah, this is long. So again, what we see in planning, people often don't think about what the triggers are to go, this is a business as usual problem versus, yep, I'm entering a world of pain. Number 3, Daphne. Thank you. The third problem here would be, once electricity gets returned, what's the problems then? Because it's usually not as simple as turning the power on. I imagine if you've got cold stored objects, after 5 days they won't be cold. What's the restart problems? And if you've had 5 days of no electricity, what is it that you can't do during that period? Does it mean your business can't run, but you can't pay with a credit card, etc.? Then obviously when this power comes back, you've got a massive issues around restoring normal business and the surge that would happen, etc. So again, good disaster planning thinks about, mitigating the problem to start with. What are the key triggers? Who do I need to talk to? What's my backup measures that I could use here? And then what happens when things supposedly go back to normal? There's then that catch-up cycle as well, where actually true normal takes a while to get there. Next one, Daphne. And mitigation issues then, good planning always says, well, actually, I don't have to have all this pain if I do some mitigation measures. So again, are there risk reduction measures you currently have for the loss of power? And you might go, no, 4 hours the fridge stays cold, it doesn't for 5 days. What are your risk mitigation measures you might apply if this was to happen, knowing that the state government's saying this is a risk? And so it really is thinking about things you currently do, which might work for 2 hour blackout, might not work for 5 days, and therefore what's the different measures you might need to think about in your planning to survive a 5-day blackout. Daphne, I think we're on to the final slide there, but to say that what I just want to make here to summarise is say that what we see time and time again, people plan for their normal disruption, their day-to-day problem. You probably normalise that in your routines anyway. It's really about, I think, planning about what the forecast worst case is, and even 5 days is probably not quite the worst case, but it's pretty bad. And if you can survive 5 days, you're probably going to survive 7. And what the challenge is to start thinking about those events that are not business as usual disruptions, but are the bigger ones, like we're seeing right across the North Coast in the current fire event. So hopefully that's got you thinking and about the importance of planning and thinking about that. Actually, to survive those events, it is going to be about who's your networks, who's your contacts, who you're going to call. Well, go and find in the town, because the phones probably won't be working after a few hours. Does the emergency management community know how important your medical supplies are? There will be generators somewhere in town. Who's got them? How would you contact that person? Do you have the linkage? They're all things good disaster planning covers. And thank you, Daphne. I better stop talking.
Okay, thanks very much for that, David. That was a very informative presentation. Just a reminder to everyone at the webinar, you can submit questions using the questions section of your control panel on the right-hand side of your screen. Okay, so just moving on to the next presentation. So, license to the emergency response planning tool that John will be providing information on. They'll be available to healthcare service providers courtesy of the PHN as part of the PHN's commitment to resourcing and supporting good disaster preparedness. So without further ado, I'd like to introduce John Williams for the final presentation, where John will give some information on this extremely useful tool. So John has been the Executive Director for HealthPoint since its establishment in 2004. He has worked in a number of large multinational organisations, including a Fortune 500 company in New Zealand, Australia, and internationally, and independently consulted to a number of companies throughout Asia Pacific. John has been working with HealthPoint's emergency planning business continuity platform for over 7 years in both Australia and New Zealand, in the health sector and across a broad industry base. John has a bachelor's degree, postgraduate diploma in business marketing, and an executive MBA. So I'd now like to hand over to John.
Great, thank you, Daphne. Hopefully everybody can hear me.
Yep, we can hear you, John.
Great, thank you. Look, I just want to touch base by acknowledging all the points that David raised, because they're very pertinent and very important. And putting some plans in place is the only way to mitigate the risks that were certainly outlined by David. So the ERPT, just to give you a little bit of background, the Emergency Response Planning Tool was developed and launched in Australia with the federal government in Australia, with the Department of Health and Ageing back in 2013. And the content comes from the RACGP working groups, who developed a series of guidelines to help general practices right across Australia have some tools and some guidelines to deal with specific situations. One of which was managing emergencies in general practice. The second one was managing pandemics in general practice. And more latterly, and really importantly, because it's becoming a big issue internationally, particularly for boards on organisations, is cyber risk. So the Information Security Guideline in General Practice was developed by the RACGP, and the first cyber module, called Cyber Incident Response, is also included in the ERPT. Now, David will know what I'm talking about. The ERPT takes an all risks approach to emergency planning. So it really outlines a whole lot of different scenarios and prompts an organisation such as a general practice to think internally about mitigation strategies, what to think about, and guides you through an exercise that really, if you didn't have that guidance and you haven't got any expertise in emergency response planning, you would probably not cover the points that are covered in the ERPT. So it assists general practices to better prepare for, respond to, and recover from impacts of emergencies, pandemics, and cyber incidents. It's managed by ourselves, so ours is the platform, and the RACGP approached us back in 2012 and said, we'd like to operationalise our guidelines, so can we put them on your platform? And we said, of course you can. So that's how the relationship came about, and it's been a long-term one and a very collaborative one. And so the RACGP are very strong partners of ours. As such, if an organisation uses the ERPT, then they will automatically comply with the 5th edition of the GP standards towards accreditation for emergency response and pandemic planning. So that's an important thing. Daphne, could you go to the last slide, please? Okay, so what support do we give you? And what I'm going to do is I'm just going to touch on this, and then I'm going to get into the tool itself and just give you a quick overview of what the tool looks like. Very intuitive and easy to use. So the best way is to actually onboard is to come and register your practice. Now you can do that 2 ways. If you know the URL, which we will be supplying through, obviously, to Sonia and also to the Centium folk. But the best way is to Google it. Just put in Google ERPT, and the very top search will be the login page for the ERPT, which is actually on the RACGP website. You put your details in there, and then we see you coming in at our end. And then what we do is we send you your username and password, which is unique to your general practice. And then all the supporting and getting started documentation with that. The other thing that we do is we provide a help desk, so you can call us within business hours. And secondly, we offer via an Outlook booking appointment provision the opportunity for you to book a 30 to 45 minute orientation session over a video call where we use GoToMeeting to do that. And then we sit down with you and get you started. And we will help you complete 2 to 3 modules, and that gets you underway. So that's really all I needed to touch base on at this stage, apart from get in and show you what the tool looks like. Okay. All right, now Daphne, we need to make sure that all the attendees can see my screen. What's the best process now?
So we've stopped sharing our screen, John, and you now need to share yours.
Okay, all right, let me just bring this up. Okay, hopefully you can see that now.
Yeah, confirming we can see.
Okay, great. I'll just put my phone down a second, and I'm just going to blow the screen up a little bit, so just bear with me. Okay, hopefully that's a slightly better text size. All right, so when you onboard and you register, you get your own unique username and password. Then this is where you come into. It says you'll find a button that says edit your response plan, and we can guide you through that. And then you come to the screen. Now, keep in mind that this is an online tool, so it's a piece of software and it's available in the cloud. And so it can be accessed anywhere, anytime, and it is mobile compatible. So we get a lot of practices that can actually update and make changes to their plan via a tablet. I wouldn't recommend it from a mobile phone unless you've got really good eyesight, because the screen's obviously a little smaller, but it is compatible with a mobile phone as well. Now, down the left-hand side, if you can see my mouse, you've got what we call the modules, and you'll see that there's a series of them, in fact, 16 in total. Now, the recommendations are for a larger practice that you consider completing each module. If you're a smaller practice, then we would give you some guidance on which the modules are that we think you should complete. But suffice to say that of the 16, there would probably be 11 or 12 that we would recommend that you complete. You'll also notice on that left-hand side, there's a little green tick besides each of the modules. Now, that little green tick appears because down the very bottom of the planning tool, on the right-hand side, there's a black button that says section is complete. Once you're happy with the content in there, you click that and it puts the green tick in there. And the importance of that is that then that particular module will print out in your published version. So if I go down and I have a look at the information that we're asking you to input, it's information about your state, your PHN, when your plan was reviewed, and then all your staff details. And we do recommend that you put in a primary and a secondary phone contact in there. We also recommend that you put a home suburb for that individual and how long it takes them to get to your clinic or your practice. And then once you've got, and you can add as many people in here as you need to. And once you get down the bottom, it's developed a staff call-in tree with all the contact numbers. And I'll show you what that looks like in a published version very shortly. I'm not going to go through each module. I'm just going to touch one or two. The second module is key contact information. Now, this is crucial, and I'll give you a couple of really specific examples. So we've just rolled out a large number of ERPT plans across Victoria, particularly in the remote rural areas where they are really concerned about bushfire risk. Now, 4 weeks ago, a metro practice that uses the ERPT got broken into, and the person that broke in set the practice on fire as well. Luckily enough, and the recommendations are that once you've completed your ERPT, you publish at least two copies, and you have one on site so that your staff within your practice can access it. So typically it would be the practice manager that has that either at the reception desk or in their office. And secondly, a principal GP has one at home, or perhaps a practice manager. In this specific incident, the principal GP had one at home, and whilst the practice was on fire, they managed to call all their staff, let them know what was happening, got hold of all the emergency services, some of which weren't there, but were on their way, and also got hold of utility providers. So not a great situation, but at least they'd done the thinking around and prepared themselves and put all the contact details in there. We also had a situation in 2017 in northern Queensland when a practice in Bowen got hit by Cyclone Debbie, and they had developed their plan, and they were without power and water for over a week. And I think the main thing that came out of that is they didn't panic. They knew they had a plan in place, and they could walk through that with all their staff and felt much more comfortable. Certainly, you don't necessarily act particularly rationally if you haven't done the planning in cases of emergency. So these kinds of tools help enormously. Then once you've got all your key contact information in here, so I'll just give you an example of some of the things that are covered. Most of these are pre-populated for your state until you get into your utility and service providers, which includes council, power supply, gas supply, water, air conditioning, cleaning, security, lift if you've got one, fixed phone, mobile, internet service providers, FPOS, and so on and so forth. As I said, you don't have to complete everyone, but the more you do, the more comprehensive your plan is. Okay. The other benefit is when, for example, you get into, say, Section 4, loss of power, and you'll see this peach-coloured area here, it automatically pulls that content into this section from Section 2, so you do not have to re-enter it. So in this instance, who's your main supplier and who is your electrician? And then the things that David talked about in terms of, has your practice got a UPS and who supplies that, and what does it connect to, and what does it power, how long does it last? Have you got a backup generator installed? And if you don't, would you consider hiring one, and where would that be? And then some contingency measures around if you're without power for a few hours, do you need hard copy Medicare forms, patient management forms, and the like? So just some very pragmatic guidelines to take you through. And when you come through, I'm going to skip down now to 7A, which is the cyber incident response. Many practices don't think about having cybersecurity insurance, but obviously now with notifiable data breach in Australia since February 2018, it's really important for all SMEs to think about having it. It's not overly expensive, but certainly worth having if you have a cyber incident. And with a cyber incident, you can ring up your insurer and they will hold your hand through the process. So it's very, very good. Now, the rest of the module, because it's an incident response plan, it will actually take you through a really pragmatic series of steps. If a member of your staff makes a mistake and clicks on a link, or perhaps you have a malicious intrusion or you lose some information. So just some really pragmatic guidelines. So if you receive a suspicious phone call, if you think you've been scammed, if you receive a ransomware message, if your antivirus software is displayed, and so on and so forth. So there are the modules down the left-hand side. And I'm just going to jump in and have a quick look, last look at module 16, which is the pandemic one. And what that takes you through is the specific guideline developed by the RACGP working group around managing pandemics in general practice, specifically thinking about influenza. So what are the staff roles and responsibilities for the pandemic leader? And all this is pre-populated, so it's a matter of clicking on the box to make it live. You can add to it, you can delete it and start again, but it's prompting and guiding you through. Who's the pandemic coordinator? What are the key roles for communication? What about staff rostering? Who's willing to work? An immunisation register, and when were they those immunisations given? Training registers, consumable equipment and supplies that you should carry and for how long, typically 2 to 4 weeks, and so on and so forth. Very comprehensive. So lastly, what I'm going to do is, once you've got all your information in there, then this is basically what you get when you follow the prompts to publish your plan. You get the emergency response plan, you get the ERPT logo with the RACGP logo, the name of your practice, the single point of contact, some initial information about your practice and the PHN and the date that the plan was approved by and by whom, some initial things for staff members to do before you think about anything else, the table of contents, and then if you can remember when we went back into the demonstration plan, all the staff contact details on one page and where they live and how long it takes them to get to work, the staff call-in tree, all your utility providers and their contact details. Very handy if you need to rely on your hard copy to make a lot of phone calls quickly. And then one thing I didn't cover, but it is in here, is all the potential risks for general practice in Australia and about how to prepare, respond and recover. And most of this is pre-populated and we guide you through these. So things like threatening behaviour, bushel grass fire, flooding, explosion, emergency exterior to the practice, tropical cyclone, not so important for you, severe weather or storm, structural fire, internal fire, smoke, gas, heat wave, pandemic. And you can prioritise these in the order that you want them to. Plus you've got the flexibility to add any others in there as well. So that should give you just a quick once over lightly about how the plan works. It's very intuitive, very easy to use, but it's really good to have us help you get started, because we know from experience that once you're underway, then the best way to do it is in modules. You do a couple to 3 a week and give yourself 4 weeks to get your plan completed. So that's me, Daphne. Thank you.
Thank you, John. The next part of our of the webinar now is to provide answers to some of the questions that have been submitted so far. And thank you to everyone who has submitted a question. And it's not too late. Just go into the control panel and type in a question if you've got something else. So I'm going to. The first question I have is for David. As a healthcare provider, what do you think is the most important or critical thing that I could do to be ready?
Wow, such a broad question. First of all, I think the first thing is to be aware of what's happening. So, for example, I live in the Blue Mountains, and we currently have our 3 different fires, either in or coming towards the Blue Mountains. And so I have my rural fire service app, which is called Fires Near Me, and I have a watch set up on that app. So I get told of every fire within 50 kilometres of my home. And you may need to put your end on mute there because it's echoing back through. And so if I was living in an area that had fire risk, which is most of New South Wales, I'd certainly have the Fires Near Me app and have a watch zone, which depending where you are, whether it's 20, 50 or even 100 kilometres, and it'll alert you every time a fire comes up. I also have the app called Live Traffic, so I can see if there's been major accidents, if there's flooding affecting the roads, if there's bushfires closing major arterial routes, if there's snow blocking roads over the Blue Mountains. It'll all be on that app, which is called Live Traffic, which will affect the staff getting to work or the flow of medicines over the mountains and other things. So I think the first thing is you need to be alert to things rather than reacting to them after they've happened. So I have another app which is called my lightning tracker. So I can track all the big lightning storms coming across New South Wales. It comes up and shows you where they are, which way they're moving. Easy. It's very easy to use. So so I know when to turn off all of my home goods so that this lightning doesn't zap my PC and my every other thing here. The Bureau of Meteorology weather app, or else the Weather Zone app are both very good apps. So Weather Zone app I use probably more than the Bureau one, but they're both good apps to be able to know if there's rain coming, storms, intense rainfall. So I think the first step is being aware. Now the other thing you might not know that your home and your practice are listed on a website called My Hazards, and that's a My Hazards app for your phone or for your smart device, and it's run by the Insurance Council, and it shows you what the Insurance Council thinks your hazards are for your particular building or your block of land. So if you want to know whether you're on a floodplain, bushfire risk, go to My Hazards. I think so. That's the first thing: being aware of what's happening, so that you're on the front foot, so you're leaning forward rather than reacting to actually something after it's happened. The second key thing is to have done that planning. So like John talked about, if you've pre-thought things, you can start moving quickly. Things like the generators, if you don't make a decision the first 10 minutes, it's not going to be there because everyone else moves. So it's about having a plan so you can move quickly and in an orderly way. The other one is to have networks, because in the end, it's the person you ring that that you've already contacted that you're going to get the best outcome from. So so those networks, as John listed in that plan, it could be the actual electrician, because a good example, when I had the big cold event in Lithgow, we had dozens and dozens of houses have water pipe breaks, and the person that rang first to the plumber got that plumber first. If you rang an hour later, you're in number 32 in the queue. So it is about having those numbers so you can be first off the mark. So that's just a few ideas.
Okay, thank you, David. I'm going to throw over to one for John, just to mix it up a little bit. One of the questions we had was whether or not, in using the tool, whether the information will remain confidential.
Yeah, and that's a question we get a lot. And so the process that we use is, so the ERPT is stored in government-approved servers in Sydney. And what happens is each individual practice, the person that registers, gets a unique username and password, and that's theirs. Now, you can come to us and you can say, I'm having a bit of difficulty, can you help me out? And I will say, if you give me permission, I can go and look at your plan, but there is an audit trail built into the software, so I have to log a reason to have a look at your plan. So the information is confidential to the practice, it goes nowhere else. So the PHN cannot see anything in your plan either. What the PHN can ask us for is a report on where a specific practice is in their planning. So we can get out of the back end a report that says practice A has completed 5 modules and they have published their plan once. And that is the extent of any reporting. So the information is specifically to the practice. Now, we do regular vulnerability testing on the platform, and what that means is we have a third party that will go in and try and break into the piece of software. And last count, which was 6 months ago, we do it annually. We had no vulnerabilities on the platform. So we take security, given that there's a cyber module in here. Yeah, it's very high on the priority list. So hopefully that answers that question.
That's great. Thank you, John. I'll throw back to another one for David. This time about the recovery phase. So again, what do you think some of the big issues that we need to consider during the recovery phase as health practitioners, as general medical practitioners?
Yep, and I'll refer to some case studies here. So first of all, I'll say that in relation to the fires in New South Wales that we've been having for the last 80 days now, the New South Wales government has a disaster recovery team within the Office of Emergency Management. So they have 12 full-time staff there. And then they have a team of staff that they contract in who are experienced recovery operators from across Australia. So they've got every one of those contractors at the moment working for them. So what happens, those people then go into communities, and the emphasis these days is to have community-led recovery. So trying to avoid the old days where you'd bring in some high-profile person and say, this person's going to save you, because that doesn't really work. So it's about working with local communities and empowering local people to lead that actual recovery effort. So that's the first thing. Second thing is, we know though that after an event like we've been through in New South Wales, there's a cycle people go through. So they'll have the event, they'll have a bit of a high because they see everyone's helping them. Sooner or later they work out that actually you're not going to get your house rebuilt in less than 18 months, and that life's actually very hard. Then they go into a trough. And there's a trough cycle. They come out of a trough cycle and have little ups and downs as they slowly climb out. So all that's very well known. So what we know is that psychosocial support for those people who need it will be a long ongoing event over many years. We know that medical conditions that people have under high stress situations, doesn't get better. So often those things become worse. We know that we're going to see outbreak of I can't remember the name, but it's the bird. It's a disease that's in bird droppings. So people now put out all their seed to feed the birds in the area. They'll then sweep the seed and droppings off the paving. They'll then breathe that in. We'll have dozens of people now reporting to doctors with that disease. Happens in the Blue Mountains all the time here. After every major fire, we put out an alert. We know that people with a whole range of issues, from mental health issues to physical health issues, critical events like this, make things harder and make those things more likely to actually happen. We also know that the rate of domestic violence will increase, and that happens in the emergency services sector as well as the public sector. And it's interesting, if you look at the Christchurch earthquake, I spent a lot of time working in New Zealand, their suicide rate is still rising, their domestic violence rate is still rising, and that's been a decade now. And their mental health, reporting to the health system there, is still increasing, and that's like a decade later. So all those things are long-term problems, and the trouble is that people within that have compounding problems. So there's a gentleman at Kylo Heights in New South Wales. His wife died 3 weeks before the fire. His house burnt down in the fire. Another gentleman on the North Coast took his wife into palliative care. She died 2 days later. When he went home, his house was gone. So you can see all those compounding factors, and that's why every person is different, how they react, how they cope. So so for us in the healthcare sector, it's just this long haul. It's not a short-term problem; it's a long-term problem. Then we'll have the anniversary in 12 months. Obviously, Christmas is coming up. When you look at just all those things just make things harder.
Okay, thank you, Dave. And I think the last one, I'm going to throw back to John. There's a suite of questions here, so it's a bit multi-pronged, but they're along the lines of, how often should I review my plan? Can I stop and start with my plan? Or if I sort of previously had a plan, can I reinstate my login and, update my plan? And when should I do that? And how should I do that?
Okay, I'll try and address all of those. Absolutely. Tell me if I miss one. So in terms of if you already had a plan at one point in time, absolutely you can. What we do is we archive those. We do not delete them. So what you can do is you can register. If you register, it may come back with an email and say, this email address has been registered previously. We'll see that. And we will reinstate that and send you the information, details, the getting started, etc. So just rest assured that your plan as you last left it is still there. There's a huge benefit in that, because typically if the information's put in there, it will take you 20 to 30 minutes to review it, make the necessary changes, which typically aren't that much, and then you're underway. Second question was, can you do it in a I think I kind of alluded to it in a modular way, so you don't have to do it all at once. I dealt with a practice in Victoria 2 months ago and they were a nurse-led clinic actually, really remote rural location, and they really stretched on resources, but she did hers overnight, basically just went for it and did it all. It would take about 4 hours to complete that. So typically what we find is most practices will do that just over a series of weeks and get it done in a modular way. So there's no time commitment, just put a reasonable time frame yourself that works with you. And the best way to do that is just put a note into Outlook. We tried to keep the ERPT as clean as possible. We didn't want to make it fancy and put a whole lot of other pieces into the software, so it is purely a planning tool, and that's the way it's designed. And the other question was, just trying to think what that one was.
It was around how often I should review my plan.
How often you should review, yeah. Okay, so the recommendations by experts in emergency response planning is you should review it whenever you have changes to supplier or staff and make the necessary changes. I mean, we typically will tell people if you can review it quarterly, that's a good discipline to get into. But we know that most general practices are super busy and they've got other priorities. So at least annually is our recommendation. And what we don't want it to be is we don't want, and we say this quite openly, whilst it complies with the 5th edition of the GP standards towards accreditation, it's not a tick box exercise. This is a product and a tool designed to support the things that David has outlined and to prepare you. So use it in that way and not just to get a piece of accreditation done. So that's the best way I would suggest that you use the tool.
Okay, well, thank you, John. Okay, I'm afraid that's all we have time for today. I believe throughout the webinar, we've provided you some information that will allow you to be able to recognise disaster risks in your area, understand what's required to plan, respond and recover from a critical incident and pandemics, be aware of the tools and guidelines available to allow you to best plan, respond and recover from the disaster. And then finally, I'm sure you would agree that this has been an informative and important webinar, particularly relevant to a lot of us right now, given the high number of fires burning across New South Wales. I think they're north, they're west and south at the minute, which stresses the importance of every organisation in being ready in the event of an emergency or disaster. And if the fires aren't near you, the impact on the electricity network is truly scary. I'd like to take a moment to thank Daphne, David and John for their insightful presentations. Thank you very much. And just to reiterate that information will be circulated in due course on the emergency response tool by the PHN, and we would encourage you to make use of this extremely useful tool. You'll also be able to access a recording of this webinar on Western New South Wales PHN's website, and the questions and answers from this webinar, if there are any more that come through in the next few minutes, will also be made available through the website. If you have any further questions or would you like further information on the measures you can take to become disaster ready, please contact Sonia Berryman at Western New South Wales PHN. And finally, on behalf of Centium and all of our presenters, thank you for joining us and enjoy the rest of your evening.